Hello everyone. Today we will discuss about a neurological topic called as neurogenic bladder. First, if we want to understand about this topic, we have to know that there are mainly three centers which are related to the function of urination or micturition. So the first one is, we consider it as paracentral lobule. So first thing is paracentral lobule. Which is also called as cortical center for micturition. So this will help a person to decide when and where to urinate. So this is the first thing. Second one is about the cord. So in spinal cord, mainly two things we have to remember. One is sympathetic system through L1, L2, L3. So this will mainly facilitate filling. So facilitates filling. Here one more center in the cord will be parasympathetic system through S2, S3, S4. This will facilitate emptying. So this will facilitate emptying. This is the second thing. Third one is at the local level. So this is called as reflex arc for micturition. Here mainly, as the urine starts accumulating in the bladder, so it will slowly get distended, so that filled sensation will be carried. So sensory nerves, like sensory inputs, will be there, and for that, in reaction, the motor action will be contraction of the muscles. The motor action will be contraction of the muscles, which will lead to urination. So this is the third part, is local reflex arc, which has two components, mainly sensory and motor. So these are the things which we have to know in the process of micturition. Now we will deal with the neurodeficit here. So if there is any lesion in the frontal lobe, that is paracentral lobule, this will lead to cortical bladder. So the defects we will mention here. First one is cortical bladder. So in this one, the person will not be able to assess himself that where to pee or when to pee. So the patient will not be able to assess where and when to pee. So this is like loss of social inhibition. This probably everyone will be knowing. Then we will deal with the lesions of the spinal cord. So any lesion of the spinal cord, like complete lesion, as happens with transverse myelitis or transection of the cord, etc. Here one thing is, the higher centers will always inhibit for the micturition, because they will wait for the ideal site to micturate. So this is like inhibitory control. So once there is damage of the cord, only the higher center will be acting. So it will be completely inhibitory. So it will totally inhibit urination. That will lead to retention, as we can see in acute phases of spinal shock. There will be retention of urine. Whereas once it starts recovering, any spinal cord lesion, if it is recovering, so during recovery, the reflex arc will be hyperactive. So it will lead to automatic bladder. This is during recovery. So here what is happening? As urine starts filling up in the bladder, even for the minor quantity, sensory inputs will be hyperactive. So it will result in contraction of the muscles, which will lead to urination, which was not expected at that minor quantity. So this will be hyperactive kind of thing. So this is automatic bladder, like a child. Even for minor quantity, they will be repeatedly micturating. So these two things are there in the cord. Coming to the third part, that is local reflex arc problems. So here First thing is sensory paralytic bladder. Sensory paralytic bladder, we'll say. Paralytic bladder. So what happens is the sensation of the filled bladder will not be able to reach the center. So the person will not feel the filled bladder. So he will not be able to sense. No sense of filled bladder. But here the motor component is fine. So the person will not be able to feel the filled bladder, but if he or she goes for micturition, then they will be voluntarily able to contract muscles for micturition. So they will wide it completely. Wide completely. So if we train them to go for micturition at regular intervals, there will not be any dribbling. So it is like alarming the patient. At regular intervals, they have to go for micturition. There the motor function is anyways fine, so they will be able to wide it completely. So there will not be any dribbling. Coming to the next one is motor paralytic bladder, we'll say. So here this motor component will not be functioning properly. So here what happens, patient will be able to feel for the filled bladder and he will go for micturition, but he will not be able to initiate voluntarily the micturition. So difficulty in initiation of urination. So this will be the presentation. The causes for sensory paralytic bladder. So the sensory inputs will be not functioning properly. That is seen in mainly Tips dorsalis and diabetes mellitus, which is affecting the sensory nerve fibers. And for motor paralytic bladder, we can consider local lesions, especially pelvic pathologies. Especially if the patient is female, any cervical malignancies can invade the motor component and it will lead to motor paralytic bladder. So mainly we have to consider pelvic pathologies. Third one is called as autonomic bladder. Autonomic bladder. Again here, it will be because of the pelvic pathologies only. Pelvic pathologies, both sensory and motor component will be affected. So the patient will not be able to sense the filled bladder and he will not be able to initiate or completely wide it. So there will be dribbling. So this is overflow. Overflow incontinence will be seen. So there will be dribbling. Obviously this will lead to recurrent UTIs. Recurrent UTIs. So the major difference between sensory paralytic bladder and autonomic bladder is here in both cases the individual is not able to feel the filled bladder, but when they voluntarily go for micturition at fixed regular intervals, that is called as alarming, patient will be able to wide it completely in sensory paralytic bladder because motor component is functioning normally. So there will be complete widening, no dribbling. But in autonomic bladder, even motor part is dysfunctional. So this will lead to the poor initiation of the bladder emptying and there will be improper contraction of the muscles. So this will lead to dribbling. So here it will be overflow incontinence and this will lead to recurrent UTIs. This is the major difference. So these are the different types of neurogenic bladder. Do read more about it. Thank you.